I want to welcome you to the dark side of therapy. This is Eric Nance, and I've always wanted to do different things in my podcast. And as you know before, I like to bring on people that have nothing to do with mental health. And I had this odd idea. I wonder if my dentist would come on and actually talk to me about how he set up this wonderful office environment. And he agreed to do it. So he is here. Stay tuned. You're not going to want to miss this. Welcome again to the Dark Side of Therapy. This is the show where we help new clinicians and new graduates get their feet wet in the mental health field, not burn out, and have great careers. Now, dentistry may not have a whole lot to do with mental health, but I can tell you this. I get nervous when I go to the dentist. I was nervous the first time I met Dr. Kemmet. And then it all came down to, I heard the 80s channel play one time. I think it was just random one-hit wonders. And I said, that's the kind of dentist office I want to be in, Dr. Kemmet. So thank you for that.
Awesome.
So I want to start with just something fun. Why are dentists in movies always bad guys? I mean, you look at Little Shop of Horrors, you look at Marathon Man, they're always just, going after people. Why is that?
I don't know how deep you want to get into this, but C fibers, nerve pain, the types of pain that is in the teeth, they only send pain. So if we touch anywhere close to them, all they're going to do is send pain. They don't send hot, cold, anything like that. They just send pain. And so when you know that you have the most simplistic fiber in the nervous system inside the tooth, around the tooth, that's why we get a bad rap.
Gotcha.
So that and dentists are weird. We just are odd people. So I think that also plays into it. So yeah, you get a lot of crazies and whatnot.
So how but you're a very well-known and respected guy. How have you avoided the craziness, Dr. Kemmet? How have you done that?
I think I came to it from a very interesting perspective. I was a farmer at first. I guess I grew up on a farm, but not really farming. My dad drills water wells and irrigation wells and stuff like that. So I'm used to punching holes in the ground, seeing what's underneath North Dakota at 100 feet or 200 feet below. So I have an interesting perspective of what is out there. But I also have a medicinal side where my mom, my sister, my 3 aunts, 2 cousins are all nurses.
Wow.
So there's a lot of medicine in my family too. No doctors, but a lot of nursing. So my dad always likes to say, when you put well drilling and nursing together, or medicine together, I mean, you get a dentist drilling holes in medicine. So here we are.
So you had some hard living. I mean, I've never worked on a farm, but friends have told me you don't want to do it because it's backbreaking work. And so you came from that.
Oh, absolutely. Yeah.
Very cool.
In fact, I was just talking to somebody this morning. Even when I went to college, most people are going to work at like Olive Garden, which I did. I worked at the Olive Garden for almost a year, but I also worked at a lumber yard, and I did a delivery truck. So I was a boom truck operator for a year and a half. Why? Because I know how to drive a truck and I'm used to physical labor. So I would work from 5 in the morning until 8, 9 at night. And so I would work 70 to 75 hours, 5 days a week.
Wow. So you know the value of a hard day's work. Yeah.
I can't stop. I mean, there's no way you're gonna stop me from working, and I just keep going and going. It's the Energizer Bunny stuff. I'm starting to feel it now. I'm 43, so.
Well, I'm 47 and I feel it too. But I'm not going to stop either because a rolling stone gathers no moss, right? So we have
what they
this
say.
need to keep going.
I've never seen moss, so I don't know.
Yeah, right? No, it's funny. You brought something up that I didn't even think we would talk about, which is I own a business too, and people seem to think that that's the thing you've always done in life, right? And I've done some jobs too that some people may consider shameful. I've washed dishes, I've power washed vehicles, I've done retail. But I think all of that stuff is preparatory for what we do as well. Yeah. I think there's links to it that we kind of forget about.
Right.
So knowing that you've done these things, and I know you're not above anything, which is awesome because that's exactly what I teach as well.
Exactly. If you see me taking out the trash in my office, it's because I am not above that.
Absolutely.
I'm cleaning the toilets. doing all of that. There's no job that's below me. I can tell you that.
And we're going to talk about that because I want to get into your office here in a minute. But I have to say, I think it was Tom Hardy that said, "I was raised to treat the janitor with the same respect as the CEO." And I just what a phenomenal quote.
Leaders eat last. I mean, if you want to look into that book,
I
fantastic,
I
fantastic.
will. Absolutely.
Yeah.
So here's the big question: how did you put together this office environment that is so wonderful and fun, and that I actually enjoy going to? Because that's a big compliment for a dentist, Dr. Kemet. We don't hear that a lot, but I like going there. How did you
Yeah.
do this?
um, I always say that you need to be able to enjoy what you do and who you're doing it with. If you look at if you look at an office environment and say you're going to work together 40 hours a week, those are the main 40 hours that you're going to be together all week. There's 172 hours in a week.
I
I
think
mean,
that's
I
right.
don't even remember. Um, it seems like that's a small amount, but it's a huge amount when you think about those are the times that you are the most rested. You're dedicating the most time to. We want to say that we want to give all this time to our families and stuff, but we're giving the prime of our lives to work.
Right.
So you
Right.
better well enjoy it. If you think of it as work, find a new job. Really, it has to be a place that you enjoy going to and you want to go to. And what's the old saying? Um, if it feels like, if it feels, I don't know how the saying goes.
I know where you're going with this, though.
If
Yeah.
you, yeah,
If
you
you
don't
like,
work a day, you won't work a day in your life
if you
if it
love what
doesn't.
you do, right?
There you go. There you go. And so it takes a long time. We hire, of course, it's hard in Mina to hire for skill,
Right.
and so we hire for personality. We want people to enjoy their jobs, and my facility is a training facility, basically. So we train what we need to happen, but I want people around me that I enjoy.
Right.
I want people that are going to enjoy me and my personality. I'm not everybody's cup of tea. I have patients that have come in and have left. I've had patients that have left bad reviews with our office, and that's okay because again, I don't have to be everybody's dentist.
No.
So I want people to come here and know that I'm doing the absolute best I can for them. We take a lot of CE at our office, so there's probably not many people that are as highly trained as we are.
Right.
The amount of money and time that we've spent and I've spent over my 17 years to do this is insane.
I bet.
Taking 150 to 200 credit hours per year over the last 15 years is just stupid when you consider that it's really 15 hours a year is what's required.
I appreciate the honesty. I never know when I work with people on the podcast what kind of honesty I'm going to get, but you've laid it out nicely. And you talk about the bad reviews. You say you're not everybody's cup of tea. My challenge to that would be, but you're fun. I mean, when I sit with you, even though, yeah, it's dentistry, but it's fun. How,
Yeah,
how could anybody come in and not be attracted? That's just foreign to me,
yeah,
Dr. Kemet.
yeah.
But
It
yeah,
it is. It seems foreign, but again, I'm going to lay it out brutally honestly.
yeah,
I'm going to tell them about how I'm going to tell them about how I think this should go, and there are so many times where they don't want to do that, and I'm not willing to compromise the outcome because I know that's the wrong path. I was talking to a patient today that I don't want to lead you down the wrong path, and I don't want to I don't want to allow something to go down that path if I'm not comfortable going down that path. And so if they feel like I'm being forceful about something, they're going to get mad about it. And that's okay because again, they have the right to do what they want to do. It's their mouth. Is it until there's some detrimental action that's going to follow their action,
right.
let them do what they want, but I don't have to be the one doing it.
So let me summarize this. You're okay with hurting people's feelings for their own good based on the best course of treatment.
Yep. You come to a doctor's office for their opinion as well as their treatment.
Absolutely.
If you're not going to respect my opinion, why do I want to get involved?
Wow. So I'm thinking it's so joyous all the time, and there's days it's not so joyous. Where
That's very true. It's very true.
so,
Yep.
so
I Many, many examples I could go through, but I don't know if I want to bore
Well,
you. But I've
let me,
got stories up the yin yang.
if we had 2 hours, I want to hear them all. But on your worst days, what is your self care? And mental health, that's all we talk about is self care. What does a dentist do for self care? What kinds of things?
You know, the old saying is that it's not a saying that dentists have the highest suicide rate,
Yeah,
right? Everybody has heard that. It's like urban folklore at this point.
right.
It's true. We're very high in suicide rate, but I don't actually believe it's just because of dentistry. Most of that is actually the business ownership. And so that's where it comes in with what you're talking about. Dentistry is hard, no doubt about it, but it's also fun. Excuse me. In the business side, I believe that's probably the most challenging because we need not just bodies and warm bodies to fill these chairs that I need to operate my business. I also need very skilled, highly skilled laborers, and we can't find them in most places, especially after COVID. Don't even get me started. So if we have a difficulty in the HR department trying to figure out, and by the way, I am the HR department, so I've got 9 employees, and guess who runs them all? And it's me. And so there's so many things that are on my mind all day long. And I've had employees comment on, I know what's going on in your life. And yet you're back there singing and you're laughing and everyone's having a riot of a time in the back. We can hear you. I mean, it's like 60 feet from my front office to the back office.
Right.
And we got the radio going, like you said earlier, and people can hear us talking and laughing and joking. And I've had employees come in, especially new employees, and they say, I know what's going on in your life. Because in my team, it's common knowledge. Talk about what's going on with each other. We're your confidants. We are your family. So they know what's going on in my life, just like I know what's going on in theirs. And there's been a lot in the last few years. And they said, how can you do that? I see you walk by with your head in your phone, like, oh man, this email just came in. What did your attorney say? What happened here? And then 3 minutes later, you're singing in the back. Why is that? Well, it's because I enjoy my job. I love helping people. What I get to do is change people's lives on a very, it seems slow, but it's a very fast scale. Sometimes large treatments can last 3 or 4 months in order to get completed. Sometimes it can be as easy as today. You just broke a tooth and it hurts you, and in 2 hours you get a new crown and we're done. So it's one of the reasons why I started training on CEREC technology, on the same day crowns and same day onlays and inlays and that technology. That's why I started doing that, because in North Dakota, we have so many people that are farmers, and if something breaks, they want it done now because they're not coming back into town and stopping their operation just to get into my 4 days a week that I'm working.
Good point.
So if they're coming in, they're not going to come in just to have me look at it. They'll say, you know what, I'll stick around for a little bit. Let's get this done. And so I'm able to really change people's lives, whether it's small as that or it's a large case like some people go through. So in medicine, it's hard to have that effect. I mean, you might have somebody that comes in and it's like you change a medication and you wait, and then you have them come in and it's like, oh, it's not working. Okay, let's dial this down and we'll try a new medication. This one just can't. I just heard about this one. Let's try this. It's working for another patient, and then you wait, and then pretty soon it could be 9 months or 12 months later, and that patient dies. I mean, drastic example, right? The patient dies, but now you go, what could I have done better? What did I was I not good enough to help that patient? What could I have done that could have saved that person's life? Was it my fault? I looked both those roads when I was young, and coming from the farming aspect, working with my hands, building things, really literally building rigs and things like that, to drill water wells and welding and stuff from 10, 11, 12 years old. I wanted to work with my hands, and I wanted to have that immediacy on someone's life. And that's what gets me going every day. it literally is a type of procedure or a type of job and career that you get a lot of satisfaction from. I love going to work, but it burns me out. And I think that's why you want me here today, because I think we all understand that. We can get to a point where it's just too much. I
Absolutely.
used to work 5 days a week. I still work 5 days a week. I'm here. I don't usually see patients on my Fridays. If I do, it's a large case where I just can't be disturbed.
Right.
Large full mouth extraction implants, that kind of thing. As I'm progressing in my career, those larger cases I'm feeling more confident with. And so I'll stick those on a Friday, but I just don't want to be bothered. And it becomes, again, a less stressful time for me rather than, two hygienists I got to go check on every hour and that kind of stuff and
Absolutely.
stop the procedure.
A couple things you've said have, well, a lot of what you said have stood out, but let me tell you the big one. The laughter at work and the fact that you said family. So let me give you the dark side of mental health. Um, I've had people tell me flat out, you shouldn't be laughing at work. You shouldn't be laughing with a client. I've been told that.
Oh yeah.
And,
Hmm.
and, and, I'm, and I'm thinking, I don't know of any study or any peer reviewed journal article that has a positive correlation between inefficiency and laughter. Do you know of any?
No,
No, because they
no,
don't
not at all.
exist. No.
Doesn't exist.
And I was doing a presentation down in Brainerd, Minnesota. I may have told you about that. And a woman there, we were talking about supervision, and she said, there's this perpetuated idea that we just can't have fun because if we are, we're not productive. I thought, where
Yeah.
are people getting this stuff? The first day we met, you said she's a beaut. Now, I know what that's from. I thought, yeah, but that sets the tone, doesn't it? That it's going to be okay to laugh here.
Yeah, it was she's a beaut, Clark.
I'm thinking,
Every day.
yeah,
She's a beaut, Clark. Yep, every
but
day.
but again, but it's so powerful because it's such a small thing, but what it creates is safety,
Yep,
and that's what you created.
yep.
So to the bigger overall point, I'll call them your employees. I can't think of a better term. They look
Teammate.
team. Your team looks happy. They're welcoming. They smile every time I walk in. You don't see this a lot, Dr. Kim, and especially in mental health, which is really ironic to me.
Yeah,
They smile every time I walk in. That's pretty profound.
it is.
Yeah,
It is when you think about it.
yeah,
Yeah, go to many places and you'll find some employees that are like that, but usually not a whole team.
right,
Um,
right.
and we work really hard at that. In fact, I've been doing this in Minot for a little over 10 years, 10 and a half years. And we're at the best place probably we've ever been
Mm,
because as people, come to my office and their tenure has now expired and they're moved on somewhere else. I've got some teammates that are here for 10 years. One just retired I came with the office. I inherited her and she just retired
right.
in February here. Um, Still one of my, excuse me, still one of my best friends. But she retired. If she wasn't at retirement age and said, you know what, I think I want to hang it up, she'd still be working. Um, I have another employee that is just at the 10-year mark now. And get this, last year she said, I need to change my schedule. And I said, no, I said, when we're here, we're a team. And and so she had to find her own way and she started working for another office.
Mm,
um, Within a few months, let's probably say 3 months, she called me up and she said, I'd like to come back if you have an opening. And she came back heart in hand and said, this is where I belong.
that's awesome.
And she needed to see that. And I had to let her have her own wings to do that. And that my other employees, my other teammates get to see that and say, wow, she went off somewhere and she was back almost immediately. And it makes such a profound difference
Yeah,
knowing that someone else who has been here for 10 years went out, tested the waters and said, no way, I'm coming right back. Because this is the environment that we want. We want people that know that they can come right up to the top, go to the business owner
yeah,
and say, I'm having a problem.
right.
I need some help. I don't know what to do. And I can do everything in my power to help them. I don't know how many times I've blown leaves for my employees. I've done their snowblowed their driveways. driving around town when it's, 12 to 15 inches of snow. Um, you name it, I've done it for them. And I think that also shows.
Yeah, totally. Two words that
Yeah.
come to my mind: humility and vulnerability, because you have it. And you know how often I see vulnerability in professionals in healthcare, about that much.
Yeah.
And
I,
yeah,
I, I want to be, I think everybody wants to be humble, and it's hard to be humble when you know what's the best thing for a patient. You're like, that's what it has to be. And it's really hard to jump back and say, well, I think if I do this, let's see if we can get it to last a couple of years. And that's the hard part. It really makes it difficult, when you know what's the right thing for them.
absolutely,
And I don't know if that's a I don't think it's a lack of humility. It's saying, I want to help you, and this is the way to do it.
absolutely.
And that can come off really as a lack of humility, and it's really just saying, I've been that down that road. I've helped people. I've I've let them go that route. If I didn't even recommend it before, that might have been my first recommendation, and now I know better.
Right.
And I don't want that person to go down that road. So it's a really hard place to be at sometimes, but it's a lot of fun knowing that we are changing people's lives, and hopefully we'll continue to do that,
Absolutely.
in a positive manner.
And it does. It starts with the moment you walk in the door, because that's if that doesn't go well, I mean, there's a good chance people will not come back. And
Yeah,
so, yeah,
yeah, and we exactly, and we say from the very first phone call, when they're shopping for, an office, I want that same feeling when they get off the phone and they hang up the phone. They go, "Wow, that was different. I like that person.
right,
I want to know more." And
right,
then when they come in, they feel it again, and then now they get to go to the clinic and meet somebody else, and they're like, wow,
right.
that person is the same as that person or two at the front that I talked to on the phone and that I'd met. And now, oh, the doctor, oh, I'm getting the vibe that this place is all this way, and that's what you're saying.
Yes,
Then
yes,
when you check out after a procedure, you're numb, you're still bleeding,
yeah,
who knows what's happening, you feel like crap, and now you got to pay a bill.
yeah.
And are you going to be upset about that? Well, probably. Who wants to do that? I'm trying to figure that one out, so that's like the worst time you ever want to have somebody paying a bill, is like when they're in pain. You don't walk out of your appendix surgery and say, all right, here you go, let's settle up. It doesn't make sense to me. So we're trying to figure out some things that we don't have to bill them,
Right, right, right.
but we also want to get paid, because it's hard to chase down money.
I know.
So
Believe me.
it's a real hard place to be, but I want them to check out and go, well, this was great. I want to come back. That was a crappy procedure, but man, they did the best they could. And when they come in for the follow up, I want them to be super happy.
Well, here's my belief, and you can disagree with this, but if you've been treated well, I don't care how crappy you feel, because last time I was there, I felt pretty crappy. But then I sat down with, I forget the name of the girl that worked on me, but I could have stayed in that seat for hours talking about just random stuff, because that's what we're doing. And so when you feel good about how you've been treated, I don't think a whole lot else matters. I really don't. If you've been treated disrespectfully or not listened to, that's very different. So to
Yeah,
me, that's the difference there.
yeah,
And
yeah,
I really hope, Dr. Kemmet, that mental health can learn something from this, because we're bad. We are so bad at taking care of people, and
hmm,
it's a shame to me, because again, that's why I wanted to bring you on, because I want people to see this and say, okay, this can be done. But you got
yeah,
to be vulnerable, like you said, the family thing. That I had no idea that's how you viewed it, but it makes sense to me. But also, you communicate with people. You tell people
yeah,
what's going on, so they don't have to guess, because that takes so much energy to have to guess what people are going through.
yeah,
Yeah.
yeah. And when I left Minneapolis, I was an associate in Minneapolis for a couple of years before I came back here after residency and working. I actually worked for the Indian Health Service for a few years, did residency
I
with
think
them.
I read that. Yeah.
Yeah, I went back to Minneapolis, worked as an associate in a large group practice for a while. It was private practice, but I was not. I was not me. I was not able to talk about faith. I was not able to talk about who I was personally. I mean, to a point. I mean, people want to know who I am, but really, coming back to Minot, these people here, I'm able to be myself,
Yeah.
and I'm able to tell people that as I'm looking at them, I'm helping them explain the creation that we are. And and I can explain why I believe this is the way that we were formed, and that we weren't, that we weren't just um, from blobs until who we are now. Like, this takes design, and it's really hard to deny that. And so I think that comes from inside of all of us. If you let that, we were talking about my shirt today.
Yeah.
So here I am, may your light shine. Like,
I love
let it,
that shirt. Yeah.
we gotta be able to be ourselves and to show the love that Jesus gave for us. That makes a huge difference. This isn't a trust issue. This is an issue of seeing that person for who they truly are, and them saying, I told a patient today, I said, you broke what I put in your mouth 5 years ago, 6 years ago. I was fixing what you naturally broke before that. That you expect me to put in something that is better than what God naturally gave you. And I don't know what to do. It's like, we're going to try it again.
Right.
Something else has to change. Our bodies are an amazing organism. I mean, the mechanics of teeth, especially. What an organism we have. What a mechanical system we have in teeth. When you start focusing on the mechanics of teeth, it is fascinating. It's absolutely fascinating. So when I get to design teeth as not only a dentist but a clinician and a lab technician all in one, it makes a huge difference on how I think. I mean, I have a chemistry degree, so I also have that behind me too. It's like I'm looking at the biology, the chemistry, the physics,
Right.
of somebody, and going, wow, wow, it is so neat to be able to do that. And I think people will see that, and I think there's this level of automatic trust, and they feel like they're part of something when they're sitting in our chair, or they're
Absolutely.
part of our team.
So I have a friend in Oregon. She's 87. She just retired last year. She's a professor for 1,000 years, and we have a big conversation every 2 Sundays. The term we use is curiosity. Curiosity, and boy, did you just exhibit that. I mean, that's curiosity is what that is. I want to know.
Yeah.
Yeah.
I really think that we're at a tipping point in dentistry, and I could go on a whole lot
No, this
long
is
tangent.
awesome. We have until midnight.
I think dentistry is at a tipping point. I think the next field in medicine is dentistry. I've got a couple of books written in my head. That's actually the working title of one of them, where I believe we can actually predictively, uh, reliably predict medical problems by looking at people's teeth.
Sure.
It's been known. We always think about, you get a heart attack, and the first thing they're going to do is they're going to send you for a sleep study, right?
Right.
Why are they going to send you for a sleep study? Well, they know the correlation between heart attacks and improper breathing, desaturations during sleep apnea, right? So they know that. They say, this person needs a CPAP machine. And so the cardiologist sends it directly over to get a CPAP machine or a sleep study.
Yep.
Why? Why can't we look at that? I'm looking at the damage on teeth. I'm looking at this person knowing that damage didn't happen just because of acid erosion, but it's there. And so we know the correlation between acid erosion and obstructive sleep apnea. We also know that only of all the people that are diagnosed with OSA, that's only an estimated 20% of the people that actually have it. That's 80% of the people that are undiagnosed out there.
Wow.
So when you start putting the numbers together, there's a massive need for people to breathe better. Now, I don't mean that they all need CPAPs. They might, but I think it's a bigger issue. This is probably the world's worst issue that is staring us down right now. When you think about someone who has obstructive sleep apnea that's untreated, you have a 3 to 5 times more likely chance of having a heart attack, a stroke, or lower lung disease. That's number 1, 3, and 5
Really?
killers. That's really.
Wow.
So what do we do about that? Now, is the killer the heart attack? Well, that was the final straw. But what caused the heart attack?
Right.
You know what I mean?
Yes,
We're
absolutely.
looking at this thing totally in the wrong aspect. We're not putting an asterisk by it and saying, well, they had OSA, or this person had a congenital issue. We're not
Right.
doing that at all.
Right.
It's OSA. Think about Judge Scalia, who died, didn't have a CPAP on. We think about Princess Leia, right?
Carrie Fisher.
Died,
Yeah.
didn't have
Yeah.
a CPAP on,
Right.
right? Carrie Fisher. So why? What we need to start really focusing on this. And unfortunately, the world of medicine and the world of dentistry have been at odds.
Yep.
We are the ugly, evil stepsister of medicine. Oh, you didn't get into medical school. You just laugh, right? Right? We didn't get it. We're too stupid to get into medical school, right?
Wow.
That's that's exactly
Wow.
what everybody believes. It's not true, not one bit. Um, but yet that's this overwhelming feeling. Why can't I, as a physician of the mouth, uh, be able to prescribe a sleep study? I have to go through the patient's primary care to write the freaking referral.
Right. Right.
What do they know?
Right.
I'm telling them everything that they should have caught
Right.
years ago. This person's tossing and turning in their sleep. They're all over the place. They can't get up. They get up at 2 a.m. and they say, "That's it. I'm up. Okay, what am I going to do? I don't know. I'm going to go clean the house." Why can't you catch that? Why am I, as a dentist, catching this stuff? Well, it's not because of dentistry typically. It's because I know what I know. Again, I've got a lot of training behind me, and I think that's where the world of dentistry is going to change. I think we're still going to have tooth mechanics. We're going to have the Aspen Dentals, the Heartland Dentals, all those places. Um, Last year is the first year that we've had less than 50% of dentists are private practitioners.
Mm.
That means we're becoming medicine,
Right.
and we need to fight to keep these private offices, because it's only us that's really focusing on what's going to happen with that patient. We need to be able to. Someone asked me yesterday, it was actually an 11-year-old asked me this: why do you own your own office?
Mm.
And I thought, that's an interesting question. And I said,
Yeah.
I said, it was actually my girlfriend's daughter.
Okay.
And I said, well, because if somebody else owns my business, they're not going to look at a $50,000 or $100,000 piece of machinery that I want because I want to help my patient. They're not going to look at that until they say, oh, the ROI is X. It has to have this massive ROI in order for them to even think about buying it.
Yep.
And for me, I look at it and say, yeah, let's just do it. I'll take a pay cut in order to help my patient. That's the reason for being a private practitioner. If I want to do what I want to do to help a patient, I'm going to do it. And we're losing that in dentistry. The amount of DSOs that are out there and snatching up offices left and right, it's insane. It's insane. And if we want to go the way of medicine, where a kidney surgery is $130,000, but the doctors get paid five.
Right.
That doesn't make any sense. Oh, because the cash procedure price is $130,000, but the insurance companies only have to pay five.
Right.
It doesn't make sense, but yet that's what dentistry is. I set my office up to say, you know what, I'm going to everybody's going to pay the same. I don't care if you have insurance or not. You're not going to have this outlandish fee that only the cash people pay because I'm taking a 20 or 30 or 50% discount on an insurance company. I don't think that's fair at all. Most of my patients are they don't have, their business owners themselves. They don't have insurance. They're farmers that don't have insurance. That's fine. It doesn't matter to me because they're going to pay the same thing as everybody else. If you have insurance, great, you get a discount. And that's really what dental insurance is anyway. You got to think about dental insurance as really the exact opposite of medical insurance. Dental insurance, you might have $1,000 or $1,500 to use, and that's it.
Right.
Caps it out.
Yeah.
Done.
Yep.
Whereas the opposite, you might spend $3, $4, $5,000, or if you have a family plan, it might be $8,300. That's your maximum that you would have to pay in, and then they'll pay on top of that. Now you have that $130,000 surgery, and they'll take care of the rest.
Right.
It's 180 degrees. It is exactly opposite of insurance. So why are we calling it insurance?
Right.
Call it a discount plan.
Right.
Say you have a $1,500 discount. Great.
Geez, we're going to have to do a part 2 because you've brought up so many issues that I want to relate back to mental health, but I won't be able to do them all tonight. I want to answer your question, though, even though it was rhetorical. You said, you said, why do you have to refer on to a physician? Because you listen to the person. You're the listener, and that's just what's required because you care. But the ironic part is you care, but you still have to do this. I have to do the same thing. I can't prescribe meds, but I can refer people who take about 10 minutes with patients and medicate them up, and I could go on about that too. But we're talking the same language here, which is care. And when you mention what dentistry is becoming, look at what mental health is becoming. It's an online world now of we don't know what's happening or what's going to happen. Credentials are harder to check. This field, unlike your field, Dr. Kemmet, this field will take anybody. Mental health will take anybody. So I could argue our field's even more dangerous, but I don't want to be one of those people. I'm a lot like you in that I want to give the best quality care, and I don't want to be just somebody on a Zoom meeting that's here to listen and nod. But I think that's where we're becoming, and I hate it. And if dentistry is going in a similar place, albeit a different way, that saddens me too.
Yeah.
Because people need to be. I feel like you're educating people tonight, and I love it because I love learning. So I just appreciate the depths of which you're willing to explain this. Yeah.
No, I've got a lot in me.
You do.
I'm surprised that at 43 years old, the amount of experience I have. I was talking with my girlfriend this weekend. It's like I'm trying to explain all these interesting parts of my life. I'm like, dang, I feel like I'm 90.
Yeah, but that's a life. That's a life well lived, though. I mean, so by the time you're 90, you're going to feel like you're 500.
I know. Well, my family tends to have strokes. We don't have heart attacks. We have strokes around age 90. So I'll be all right till then.
I was going to say that gives you, God willing, you live even past that.
Yeah. I like to hit the brick wall at the end because I know where I'm going. Take me now.
Absolutely. I know you're a busy man, and I'm honored that you came on to do this. I can't say I got more than I expected, but the breadth of vulnerability is something I don't see very often in people. And Dr. Kemmet, thank you for your candor because again, this is going to mean something to people, and I'd love to have you back at some point.
Absolutely. It's been a pleasure. And I hope I didn't talk too much. I really appreciate what you're doing, Eric. And you're always a breath of fresh air every time I get to talk with you. So I appreciate it.
I appreciate that. And this gives me a lot of food for thought. And as listeners tune in again, this is what we learned from our dentist. So don't be afraid to watch this one. Okay. If you liked it, please hit like, please subscribe. And as always, follow us and leave a comment. Dr. Kemmet, it's been great. Again, thank you so much.
You bet. Thanks, Eric.